Today, I want to just briefly tell you a little bit about what we've been up to in Columbus with respect to children's health, environmental justice communities, and of course, the public health Exposome. Okay? And by way of introduction, this is just an outline of what I will be telling you or sharing with you. Yes, a little bit of history about Columbus. Also, it is in fact place. Paul did an excellent job with respect to sharing with you that these disparities that we are seeing are in fact place-based. And of course, he introduced you to the social ecological life course framework that we use. That would be the public health Exposome framework. And we have a great analytics tool chain. We don't, if you want to read about that, just sort of Google any one of us over the last 10, 12 years. And then I'd like to share with you the work that we've been doing with the CDC to bring forward the Health Opportunity Index as it relates to the Social Vulnerability Index. And so I want to share with you that data as CDC is moving forward with that. As well, in talking about the HOI, Health Opportunity Index, I'm going to point out to you some of the built environment correlates there with regard to connectivity, accessibility, and mobility of the cohort in Columbus in these EJ communities. And then I'll tell you a little bit about the vaccination rates in these various EJ communities with respect to the percent population, okay, and those rates. And then I'm going to change gears and move towards talking a little bit about what used to be called the summer slide with respect to COVID, right? And so some of these issues we've interrogated in a robust fashion. My senior student, Heather Lahusky, her dissertation is on these concordant issues that we find between COVID, and that span from 18 through 22, 23 maybe. She'll be presenting those final data at the Society of Toxicology meeting, which is in March in Salt Lake City. Okay, we rotate, so skiing is good. And so I'll be sharing with you some of those markers and variables and factors that we found to be operative in establishing those concordant issues. Okay, so great. Let's get going here. So this is our slide that we use to basically indicate that yes, these issues are place-based with respect to disparate health outcomes and healthcare disparities. They are, in fact, different sides of the coin. They're different. They're not synonymous. Those can't use those terms in a synonymous fashion. And just looking at where people live, work, play, and pray, certainly, if you consider for a moment, if you will, consider yourself in such a network, right? You live somewhere, you work somewhere, you play somewhere. I'm Presbyterian, so we go to church a little bit more, pray, yes, quite a bit. And though that constitutes a very complex network, okay? And so in our analyses, we tend to use very structured, supervised and unsupervised clustering methodologies and a mixed methods approach. Our paradigm and tool chain analytical has been written about. We just published a paper in EHP, so you can check that out. It's in the most recent edition of Environmental Health Perspectives. And so in that complex network, we of course interrogate that network and the exposures to chemical and non-chemical stressors using our public health Exposome framework. Now, don't have time to go over with you all of the outcomes that we've surveyed. Suffice it to say that they are under the, in terms of population level disparities, we've surveyed cardiovascular, diabetes, cancer, low birth weight, preterm birth, infant mortality, and the like. But today, I simply want to sort of give you an overview of the syndemic-related outcomes, okay, during the COVID-19 syndemic from um, 2019 through up to present time. And of course, tell you about that developmental slide, okay? Yes, and so we were, several things go on simultaneously in parallel, of course, and we were tapped by our public health, local public health department, subsequent to CDC requesting that we do, that Columbus basically do an evaluation like most municipalities in the United States had to do. I don't know too many people that came out great in the syndemic, other than maybe Massachusetts and Maine, perhaps, some places. But everyone else was sort of right there in the middle. But nevertheless, they asked us to survey and look at how the local public health department did with respect to looking at outcomes in minority communities. These minority communities were environmental justice communities, okay? And so we did so. So I'd like to share a little bit of that with you. Clearly here, the focal zip codes and the most low census tract areas in Columbus are 43203 and 43205. And look at, and I don't care what category you look at, right? If you look at 43203 and 43205 in terms of these socio-demographic and environmental types of outcomes here, you'll see that they are, 2-3 standard deviations below the mean, okay? And so that is why the group from the Near East Side came to Ohio State and asked my dean if he could send someone to sort of help them look into these issues. Well, that's been, 8 years ago now, okay? And we've since had to build back up the trust from these communities and in these communities for the havoc that was bestowed upon them way back in the pre-60s, okay? Redlining started in Columbus, okay? 3 Ohio professors, white men, okay, at OSU came up with that framework of redlining. Read it, the history's all there, okay? If you don't want to talk about what department, they were not from public health, suffice it to say, okay? And of course, that went on up to the senators, and then of course the US government co-opted that, okay? So I feel somewhat responsible, and I feel it's my mission to sort of begin to right those wrongs, at least look into it, to show the harm that it's caused, the disinvestment in those particular communities. And it lasts until today, as Rosalind said. It's still going on. Illustrative of that, well, yes, so this is, as I said, parallel. We had several parallel tracks going here. The CDC, of course, began starting with the Program Development and Services branch, right? Began to look at, this was now we're up to maybe 19, began to look at health equity. And what are some of these indices related to health equity? Well, as we know, as COVID continued, using the social vulnerability index, those deaths continue to soar, okay? And so they invited a bunch of us down there at different times to go through and walk through all of the indices that we use to sort of establish vulnerability, if you will. Everyone has heard about the social vulnerability index. That's what we were using. Well, there's several other indices that could be used, okay? And so I went down there to tell them about the Health Opportunity Index, yeah? And the HOI uses principal component analyses and convergence analysis, in addition to several other indicators that I'll talk about very, very shortly. But suffice it to say, HOI does a better job at identifying variables and factors that intersect with the social determinants of health. We had to prove that. Right? And this is an HOI card. The HOI has a composite index, okay? That's what you end up with. The areas are environmental, and look at all the variables under there, consumer profile, economic profile, and a population mobility profile. And I think we all agree that population churning now, yes, that's the movement of people in and out of these census tracts, is a pretty good proxy for what gentrification may be in fact doing. There's another identifier there, okay? And then the convergence analysis with respect to the pandemic, the convergence actually was able to sort of show you how these health outcomes and those variables interact simultaneously to result in poor mental health, diabetes, stroke, coronary heart disease, and of course, eventually death, okay? And so this is Metropolitan Columbus, Ohio. These are vaccination rates, okay, as you see over there. And I hope you picked up on the legend for the HOI as you saw that the lower the HOI number, the poorer the health, okay? And so those census tracts that we are looking at are right in this area. Whoops, okay. Oops, maybe it's not on. But I think you can see those light colored zip codes, 43203, 05, 22, 15, 02. You see that area there? That's actually the area that's most adversely impacted in Columbus. And it goes all the way down south too, as you see, 07, 09, 06, and so forth, so on, right? And so when you put the social vulnerability index versus the environmental burden index versus the HOI, that area right there, and I don't know why this isn't working for me somehow. This area right here, well, maybe I can use the pointer. Yeah, this area, oh, it doesn't show up. Yeah, but you can see that blue area there. Those are census tracts. There's 57 of them, and of course it's in quintiles. You can see where those are the census tracts where those 1900 people passed during COVID. Now, you don't see the EBD didn't pick it up, nor did the social vulnerability index pick it up. And this is why the CDC is moving forward with scaling this nationally. And so you'll be hearing about that very, very soon. Other challenges, the mobility, accessibility, and connectivity challenges. Well, here are some space-time prisms and network time prisms for the intervention that Columbus did, and that intervention was what? Pop-up COVID-19 clinics, okay? Those are indicated by the circles. Those are called Vax for Cash sites. Yes, you give people money, it's like, operant behavior in animal, when I work with my mice and rats, right? Conditioning. And so those, as you can see, I have 15-minute and 30-minute time prisms there indicated. And yes, there is coverage in those low health opportunity areas, low health opportunity areas. However, you're talking about one time, pack up, come give vaccines, pack up, come back, whenever. And so how do you think that went? Even for where you all are from, I think everyone in here had that intervention of pop-up sites, right? And so when you began to look at where those resources were deployed and the frequency with which they were deployed, you find that the scenario that you see here, these are the vaccinations by zip code. And you can see, well, some places got visited more than others, but in the long run, we see here that by this plot, there's clearly overrepresentation of Black folk in those particular lower vaccination rate zip codes, okay? Not good, not good. So while we were able to convince Columbus Public Health to, put these and go for an increased presence of these vaccination sites we didn't quite get there. Okay, so the frequency is fun. Maybe perhaps it should have been there every day in those areas, and perhaps we would not have seen the death that we did see in those areas. Okay, and so I'll show you the recommendations that we made at the end of the talk. But now I want to switch gears while I still have time before Pat yanks me off the stage. The work that we're doing with Columbus Early Learning Centers. And so I had to establish a very focused, dedicated stakeholder group to work with me on these 4 EPA grants I was telling Kevin in the break there, that it was quite a challenge. But we're working with Primary One Health, which is a federally qualified health center. CareSource is the major Medicaid provider in Ohio. St. Vincent's Family Center takes care of our mental health needs, as you see here. The Northeast Ohio Black Health Coalition is helping me establish policy boundaries. We're using that framework over there, and it's dark for a reason, Bob. Do you see those equations on my slide? Good. Yeah, you're not supposed to be able to see them. Anyway, but yeah, that's security, job security for me. And then you see on the bottom there, Columbus Early Learning Centers. Columbus, like most other municipalities, has kindergartens and pre-K centers that are in low resource areas. And we we started working with them in, as I said, 19, pre-pandemic. And now we're at a point where we are able to begin to address the interactions between we call it our Exposome, our neighborhood characterization using Exposomics, okay? And these are some of the national data in reading and math, using the Get Ready to Read, particularly for reading. And as you can see here, in elementary and middle schools, right? This has been very, very well documented, pre-COVID, and then, of course, for 22 and 23. Well, what's missing up here? The pre-K kids. And that is what Heather's dissertation is on, the pre-K cohort. So working with them, we went and in a retrospective manner are looking at 487 to be exact, preschoolers. These are the Columbus Early Learning Centers. As you can see, they're sort of clustered there on the east side, Broad Street, Main Street, and one up there in Linden Park. And those are buffers, 500-meter buffers around the 487 students. And some of them are superimposed on each other, but that's 487 clusters there, okay? And we use 1,000 meters for the centers themselves. And when you look at those centers, the 4 that I just showed you on the previous map, when you look at population, okay, when you look at diesel particulate matter, when you look at annual PM 2.5, the RESI toxicity concentrations are the most interesting. It's unitless, but it's an EPA. I really like that model. I mean, they really worked very hard to bring that to fruition. It's taken about 3 years to do so. So we used to look at the toxic release inventory to look at emissions, right? Point source emissions from smokestacks, for an example. The RESI takes that into the community and tells you concentration distant from the point source, okay? Tree canopy, everyone knows the built environment. Yes, more trees, the better you are, right? We all know about the urban jungle, if you will, okay? No trees anywhere. And then, of course, transportation and, of course, the health opportunity index. As well, when you look at the students, same thing. And when you look at those trends, you can see that there's something awfully wrong with this picture. These variables, these exposome variables that we will build on. And this is actually nested. Many of these variables are actually nested within our public health exposome 4.0, Paul. Yeah, not to mention, and Juan Su's working on the 5.0. He has a workshop tomorrow, and he can tell you about those. Mhm. And so I hope you see those p-values are awfully small. Okay, it's not an accident. And then, of course, some of the other variables we're looking at here. These are just the students here, right? And you can see where they are actually, many of these students, is 487 of them, of course. But look at the numbers or the percentages or however you want to look at it. Look at where they are with respect to those EJ communities or the Health Opportunity Index census tracts. Yeah? Okay? There's a normal distribution. You can see, we're skewing, we're trending one way or another. Once again, tree canopy, there you go right there. Okay? Sort of trending as well, not in a good way. As well, the RSEI, RISI score values, right, for the students. Yeah, the darker the number, you're sort of trending towards a little bit of potentially elevated levels, right? And then that same holds true for PM 2.5 in terms of these annual concentrations. And so remember, you're looking at that buffer and this 500 millimeters, but that clearly in trending in the right direction. In terms of hazard identification, we say this is cause for concern. Okay? Yeah? Mm-hmm. Yes. 1 minute. Okay, thank you. And so in conclusion, I knew I was prepared for that. Yeah, and so these are just some of the recommendations that we made to the city with regard to the CDC minority-facing community study there. They had health advisory committees. We advised them and made a recommendation that they reconstitute those. That's the way that the community connected with the city in terms of the liaisons and the public health department. We also recommended that they implement the Health Opportunity Index. We don't have to recommend, the CDC will do that, okay? Yes, and of course their management processes and tools, and we need to get to see. Thank you very much. I enjoyed my time with you all. If anyone has any questions, this is online. You'll be able to see it there. Thank you very much and have a nice evening.